Hi everyone, and welcome back to our part 2 of our two-part series on breastfeeding with the rural perspective. So firstly, thank you to everyone who watched our first video. I hope you enjoyed it, and I hope that it helps you for future campaigns, whether it's related to breastfeeding or not, or any health awareness campaigns that you're going to do, whether it's in varsity, in ComServe, or in the future. I hope that was helpful to you. So today, the second part of our series, we're going to be discussing how do we actually do it. Like, what are the tips and tricks to making it successful? So what are the things you need to consider? That's the first part we'll be discussing. And the second part we'll be discussing what I've done and what I know other ComServes in other rural settings have done. And yeah, so to start off, first things to consider related to breastfeeding, we always think of severe malnutrition, so SAM. If I'm looking down, it's because I've made notes so that I don't miss anything. So often in a hospital setting, the chief dietitian or the pediatric dietitian will do the death reviews for SAM related cases or be part of the death review meeting related to that case. In my setting, I am the only dietitian, so I've been doing the death reviews. And often when you do the death reviews, there's a section that asks where did the mother attend their antenatal care, what clinic did she deliver in, and those things are key things you can actually use when targeting clinics to educate. So I'm not going to use an actual name. Let's say you have 5 clinics: tree, orange, pear, strawberry, and blackcurrant. And you find a trend that actually blackcurrant has a lot of SAM-related deaths. So a lot of moms that are coming who have attended antenatal care there are coming into our hospital with SAM or their SAM deaths. So not only for deaths, even when you having the admission, you ask what is their regular clinic, so you know where most of your severe malnutrition cases are coming from. So for me, couldn't do it because of the pandemic. My goal was then to go to those clinics and attend the antenatal care there. So do some training with the nursing staff and also ensure that the antenatal care that is provided is of quality, because we are definitely having an influx of mothers who are coming in with malnutrition, which is related to the poor breastfeeding rate, because malnutrition under 6 months is problematic because babies should only be breastfeeding. So that's firstly. Understanding where your malnutrition is coming from will help you identify places that you should target. And secondly, understanding the belief system. So as we've discussed in the last video, I spoke about not taking Western medicine as the only way and the right way, because that's what we've studied. We've studied Western medicine, and I have a degree, which I'm proud of, but I need to understand that not everyone follows what a dietitian says or comes to a dietitian first. Not everyone goes to a doctor first and follows what a doctor says, and the same for other professions. So understanding what people believe and where people start before they come to you, where they go for their primary care before coming to you, and targeting those areas. So the goal was to also try to speak to traditional healers in the area and speak to them about breastfeeding, because people trust them and people believe them, and people use them as a source of information. So informing them about what are the guidelines will actually assist us as healthcare workers to ensuring that we take out a good message to the public. And then thirdly is statistics. So we've done SAM cases and SAM deaths, allowing us to know what our target is. 2, understanding the beliefs of the area. 3 is stats. So statistics actually dictate what you should focus on. So if we're not speaking about dietetics solely, if you are practicing, let me say, audiology or I can't think of any other practices now, physiotherapy, understanding what is the what is the biggest problem in your setting always allows you to work better. For me as a dietitian, most of my cases are nutrition, but understanding, I spend most of my time in my pediatric wards and maternity because I understand that we have a higher death rates related to that. But I'm just going to speak about general statistics. So in South Africa, 27% of children under the ages of 2 years old are stunted, so that speaks to malnutrition. 31% of children die due to malnutrition in South Africa. So that's a third of our children die due to malnutrition. So already we can see there's a large part of my work needs to be in educating mothers. And from research that I did when I was still a student for my thesis, one of the things that I picked up is that because of poor antenatal attendance and antenatal education, my study was focusing on beliefs and attitudes related to breastfeeding. So because of that, mothers by 7 to 8 months haven't developed the want to breastfeed or haven't developed the understanding, so therefore can't develop the appropriate attitudes and beliefs towards breastfeeding. We know that beliefs and attitudes lead to our intentions, so informing those attitudes and beliefs is very important as healthcare workers. And I read a little saying this week. It said, let more children turn 5. Basically, meaning that we want more kids to live. We want more kids to reach the age of 5. We want less under 5 deaths. So focusing on those things that we've already discussed, looking at the SAM reviews to see who we should be targeting, speaking to the people in the community, understanding where they gain their information and allowing that information to be more broad so that it can help the society as a whole. And then the fourth one is this is the fourth and last one, find someone that people trust. I'm a ComServe dietitian and I've been here 1 year only, but before me there's nursing staff, there's a social worker, and for me someone that I know that they trust is the nursing staff because they speak the language, but also the social worker. Anywhere you go, make sure you make friends with the social worker. They always seem to know more, they always seem to find underlying issues, underlying reasons why the patient may or may not listen to you. So with my Breastfeeding Week campaign, I involve the social worker just to make sure that people don't only see me as a new face, but see someone they've seen around in the hospital, someone they trust. She's been a social worker in the area for over 10 years. So people know her, people see her in the clinics, people see her around. So yes, so the 4 things I think are so important to consider. There's definitely more, but I just thought these would be great. So SAM vets and SAM reviews, knowing where the malnutrition is stemming from so that you can educate those points of entry in terms of education, understanding the beliefs and feeding education into those areas. And then thirdly, understanding your statistics. Fourth and last, find a support that mothers already trust so that you can do better. Okay, so the second part is on activities. So I always believe songs and music get people together, and even if you make a fool of yourself and you can't really sing and everyone's a little bit out of key, it gets everyone in a light mood, everyone's laughing, everyone's happy. So we chose to sing a song, and then we were going to decide between 2 trendy songs, because a lot of moms are young and trendy music is something everybody loves. So the first choice was Jerusalem by Master KG, which was very difficult to put breastfeeding words into. And then we ended up choosing a song called No No, and we just put Sotho breastfeeding words and breastfeeding education into the song, and the pediatric staff helped me with that, and we sang it to the moms in maternity and those who were attending the antenatal care. So moms were laughing, moms were having a good time, moms had their phones out taking videos. So even though it was funny and eventful, it's something I'll remember, it's something that kept the mood light. And then after that, me and the social worker, I spoke in English, just giving breastfeeding information, and then she spoke in Sotho. Again, the figure that they know and someone that they recognize, that is often in the ward, and also in the language that they understand, is so important. We also gave them parcels. The parcels just had breastfeeding education in both English and Sotho, and some fruits in a juice box. Then one of the things we also did was we gave all the staff pins that had the breastfeeding symbol. So we gave staff, from cleaning staff to management. So everyone in the hospital facility was part of the breastfeeding, even if it wasn't active as singing or counseling or being part of the activities. But just having that and people recognizing there's something happening, I think that is a small but significant thing, and also involving all parts of staff. I don't know if all practices do this, but the 10 steps of breastfeeding, I think it's step 1 and 2, and it just speaks about that all healthcare workers are part of it. And when you do training, something that's important is the security guard, the cleaner, management, everyone should know something about breastfeeding, because breastfeeding is essential to our practice. So those are some of the things that we did. The things that we planned to do was get t-shirts with breastfeeding quotes at the back in English and in Sotho, and the thought was that we were going to get the maternity and the pediatric staff, and everyone was going to pick a quote they felt was impactful. I think it would be nice to have one that's cohesive, but I think it's better when it's something different, that every time you do see a healthcare worker, there's a different saying. So that's something we wanted to do. Something I know that one of my ComServe friends did. She and the OT made some tote bags, and they painted some sayings on the outside, painted the breastfeeding logo, and it was hand knitted, hand painted, but it's something they can carry around, something they can remember. And even if they don't always read it, other people read it when they're taking it to the clinic, other people read it when they're in a taxi or so forth. And so think of activities where people are light and happy and excited, and always giving a gift. That's one thing I learned as a student. If it was just cutting up fruits, if we were going to do a talk at a creche, having fruits, just having something that people take back and something that people will remember, makes you memorable and makes you more impactful. So that's about it. I'll insert some pictures and some videos of some of the things we did, and all the best. Thank you.